I'm Dr. Anne Sullivan. I'm a general orthopedic surgeon, and I work in our Department of Orthopedics at Ohio State University. I also take care of orthopedic infections, so I take care of a variety of problems and have a little bit of a subspecialty as well. I like to think of myself as the person who takes care of some of the unusual problems and maybe some of the very challenging problems that present to our medical center. So I chose orthopedics kind of because it chose me. It's always been something I've been interested in, and I didn't even necessarily know what it was called, but the study of the body and how it moves and the involved structures has always been fascinating for me, and things just kind of evolved, and that's where I ended up. When I take care of a patient, I like to think of my style as being a little bit informal, in that I think it's easier for a patient to be comfortable if their physician is more relaxed appearing and acting. I also like to think of myself as the patient in the sense of how would I feel in this situation and how would I want people to treat me, and try to respond accordingly. And sometimes that's different for different patients. Some patients prefer a little more familiar, and some patients prefer things to be a little more formal. But I like to think of taking care of the problem the patient has in terms of how I would want someone to take care of that problem for me. In orthopedics, our patients don't necessarily come back to see us for their yearly visit because we hope that they're done and don't need us anymore. I love seeing my patients, I really enjoy them, but it's wonderful if someone calls and says, I don't need to come back for this appointment because I'm doing a whole lot better, and I'll call you if I need anything. It's also fun when they come back and say, hey, I'm doing great and this is what I've been able to do, and they've gone on a vacation or something like that they weren't able to do before we took care of them. I like to hear that my patients are doing well. It's really rewarding to take care of some challenging problems and then actually see the patients be able to improve.